Okay, we're back. We just went over the Home tab. And if you don't know, my name's Dr. Stephanie Mulick. I work at Tayani Institute, and I'm making these videos for my staff who are learning on Nextgen, or might be helpful for anyone else learning on Nextgen. But we went through the home page. If you missed that, go there first, because now we're going to go to the intake page. So you click on the intake page, and here we go. So the intake page is kind of neat. You can see, again, just like on the home page, their last dilated eye exam and pressure checks and things like that. One other thing on any of these pages, these little squares or rectangles, I guess they are, can be minimized or opened up. And if you minimize them, they can actually be moved to a different location if you don't like their positioning or the order that they're in. So just something to think about. You can position the order however you see fit. There may be orders in here if they had an order for a test or something. You might see that in there. This is where we're going to put in their reason for visit. This is very important. This would be their chief complaint. So today is August 22nd, and you can see I am in the wrong tab. It says April 11th of 2023. So we don't want to start writing in the wrong date. We're going to close this out, but that was a good reminder. You always want to check the name, date of birth, as well as making sure you're in the proper tab. So there's two ways. You could potentially just click on August 22nd and leave this open, but to cover yourself and make sure you don't accidentally write in it, I would recommend closing out on that tab. And don't change anything on the old date. So we're going to go to the August date, and we're going to scroll up, and we're going to go to the intake. So now we're in the intake tab, and we scroll down, and again we're going to start with the reason for visit. So the patient could be here for many reasons, obviously. There are a few listed here. But one thing you never want to use is routine eye exam. I don't want that to be part of our choices, but it is, but we're going to ignore it. So pretend like that top routine eye exam isn't even there. You could go through if one of these were their complaints, then we can just click on it. For instance, if they had a headache, it would automatically open it. You have to click on the reason for visit before you start typing in their chief complaint. I haven't figured out why, but you can type here their chief complaint, or you can type here their chief complaint. So it doesn't really matter. They're all going to go the same place. So let's just say but the one thing that does matter is clicking on the reason for visit. If you don't click on it and you start typing, then actually everything you just typed will not be saved. So make sure that your reason for visit is highlighted in blue. You can either do this clicking these little blue icons, location, you can say headache with both eyes, or the duration, maybe they've had it for a week, and the frequency when they're focusing, we could say. These little things kind of help you just get an idea of what you can put in here, but you don't necessarily have to put those. But you do have to click at least 5 of these little tabs, which means you have to at least ask them. So if we're talking about a headache, we may say, how long have you had the headache? How often do you have it? The onset could be like sudden or gradual. If the VA is affected, we can ask them, do you feel like your vision is affected? And the timing, so this kind of gives you an idea of what the timing could be. It's frequent, constant, intermittent. So we'll say it's intermittent. But you can also free type as well. So free type as you please. And then if you free type and you're not clicking these little blue things, you just need to make sure you click on the ones that you suggested. Then you hit update and you can close this tab and it'll pull it down here into your reason for visit. And if you need to edit it, you click on it and you can edit it again here or here. I don't know what the difference is, but that's how it is. And then you just always want to hit update and then it updated. If you had a second reason for visit, they have redness, we'll say, you can click that. Again, you have to make sure you click on it and you can write it. If you hit redness by accident and didn't like it, you can just delete and then you can close out. If you don't like any of these chief complaints and you want to write something else, for instance, let me think of something. Let's just say the patient has dryness. So you can say dryness. It's not listed here, so we click dryness. Again, you want to make sure you hit dryness, and then you can either free type here, or you can again ask. So how long? It's been 1 day, and the frequency is all the time, and the onset is sudden, things like that. Or you can just say, is your vision affected? They can say, yes, vision is affected, and then you again can free type in there. You just have to make sure you click the 5 squares and update. And then if you didn't click one, just make sure you delete whatever you didn't use, and then you can close this tab. And it should put both of your chief complaint. If someone has diabetes, you want to put that in there too. So we can say diabetic examination. On a diabetic patient, you do want to ask their last blood sugar. So we'll say 112. Their last hemoglobin A1C is 6.7. And then it would be good to note what medication they're taking. So they take metformin. This is not where this doesn't substitute for putting their medications in. It's just good to have it written down so that we can make sure that we know that. The other good thing to put in here is, for instance, with this dry eye patient, we can put in what drops they're using. So it would be necessary to put in what drops on any type of dry eye patient or glaucoma patient, because we need to look back and see what drops they're currently taking. So we can say currently using refresh, but you don't want to just put refresh drops. You also want to say how long. So currently using refresh drops 4 times a day, which would be the QID, or you can just type in 4 times a day, OU for both eyes. And then you can even elaborate like drops are not helping much, or are helping, or whatever it is, are not helping much. Or sometimes people say the eye drops help very temporarily, so they need to use them often, or anything like that. And then you just make sure that you click the proper clicks and update. And then we close out of there, and then we got that, and then dryness, and then we got all of our new stuff we put there. In history, it's important if they've had any eye surgeries or any past diagnoses as far as their eyes, that we put them in here. Let's say the patient had LASIK. LASIK is a refractive, so you can click this. If you're not sure what that means, and you just type in LASIK right here, it will allow you to type. But if you type refractive, since now we know it's refractive, it'll ask you. So if you're nearsighted, farsighted, a lot of times people get LASIK if they're nearsighted, but that's not always the case. So if you ask them, could you see without glasses up close prior to LASIK, then that usually means they're nearsighted. If they needed reading glasses, that typically means they are farsighted or hyperopic. And if they were in their 40s and needing reading glasses, that's usually what's called presbyopic. So that is good to know. It's also good to put which eye, so typically it would be both. There could be certain circumstances where they only had one eye. And then if you can get a date out of them, or even at least a year, that would be good. So the procedure date is what we want. Even if it's the year, if they can give us an estimate, we'll say it was 2008, and then we'll click that in there. If they happen to know the surgeon, we can put the surgeon in there as well, but that doesn't always happen. So, but this just gives you an idea of what to put in here. Once you are done, you must hit save and close. And then you'll see it added to the list of histories. So I went through the home page earlier and talked about adding medications and allergies. That can also be done on the intake page. However, it's good to do it on the home page, and then once you get here, if you realize you hadn't done it, it's another place you can do it, but it's just kind of as a check to make sure you did it. You also want to make sure, for instance, on this patient, we added penicillin, so it wouldn't be reviewed no change. It would actually be reviewed and updated because we added that allergy to penicillin. Over here, we have the medications. It already says reconciled. And then on review of systems, we're going to say globally normal ophthalmology. And if anything here is different, you can change it. For instance, like allergies. If they have like hay fever, you can put positive hay fever and then save and close. And then it ended up changing it to positive. Okay. That is the intake, and we will move on to history in the next video.